Okay, so Dr. Board here, just going through how to renew your warranty while still enjoying the ride. And we're on the part 2 section, and we're going to dive into osteoporosis now. So part of being able to be active and functional for the rest of your life is also having good, healthy bones and joints. It turns out that the risk of osteoporosis in men and women is probably higher than you think. 25% of women actually develop osteoporosis right after menopause or around the perimenopause period. So as a practitioner and in your own life, this is part of the time where you really need to start thinking about doing a DEXA scan or screening your patients. 50% of women are going to have a fragility fracture, which is actually a fracture that's not related to trauma. Out of 1 in 4, sometimes even 1 out of 3 men will develop an osteoporosis. Men more around age 70, because of course men tend to hang on to their testosterone and estrogen a little bit longer actually than women. But this is the risky part. People don't realize, but 1 in 5 people can actually die from an osteoporotic hip fracture. And sadly, of those that actually do heal, half of them are going to end up in long-term nursing facilities or in wheelchairs. So this is something we all want to avoid in ourselves and our patients. Sabotage our ability to build bone. Smoking. Smoking decreases blood flow to the bone, doesn't carry the nutrients to tissues for healing. Excessive alcohol intake. A lot of drugs interfere with bone density, and these are just a short list. And obviously, autoimmune diseases that increase inflammation can also interfere with bone density. Lack of exercise, dieting and weight loss surgery, menopause, like we talked about, loss of hormones through oophorectomy or andropause, or chemical like aromatase inhibitors for prostate cancer and things like that. All of those can, when our hormones drop, that is going to affect bone density. Now, prolonged stress is like having nonstop steroids in your body, and that's going to decrease bone density. And also any inflammatory processes, infections, anything involving the gut. Osteoarthritis can also affect osteoporosis. And I want to talk about the gut, because the gut is really important as far as bone density and maintaining and preventing. There's a couple of papers I want to show you. There's many papers out there, but I want to point out that these are done in young adults. In this particular paper on the left, using proton pump inhibitors, which are used, it's one of the most popular drugs out there. When they use those in children who should not have osteoporosis, they are children, they're building their bone. They actually saw that in children and in young adults that there was a significant dose response effect when PPIs were used. Also, acute pancreatitis, again, not having the enzymes that we need within the gut to absorb our nutrients, will also affect osteoporosis. You can see in this case, the risk of osteoporosis was the highest, of course, in the female patient. So think about this for a minute. If you add menopause or dieting along with an inability to absorb your nutrients, think about that. Those folks are really going to be at higher risk of osteoporosis. So it turns out that inflammatory bowel disease, even again in young people, I chose these studies again because even in young people, inflammatory bowel disease will lead to changes in bone density and microarchitecture, which is going to lead to fractures, and reduced bone density in children that have celiac disease. Now, I like this study. This is an exciting study because it showed that not only was a bone density issue, but lots of other cytokines, inflammatory markers go up when you give wheat and gluten to people that have celiac disease. But the good news is down below, where it showed that when you actually went ahead and put these folks on a gluten-free diet, that all of their and their bone density all improved. And so that's a good message to us. If we have gluten sensitivity, if we have celiac disease, that we can actually reverse what is going to happen to us if we continue to eat gluten and wheat. And there it is again, another PPI. It turns out that the acid in our stomach is incredibly important. It doesn't just have the role of helping us absorb iron, calcium, and other nutrients that help us build bone, but it also helps kill microorganisms and helps protect the gut. It assists in digestion. And so these are some studies that show how using and the overuse of PPIs has not just been associated with osteoporosis, but lots of different chronic conditions like dementia, kidney disease, myocardial infarctions, and dysbiosis. And again, anytime you're thinking about gut dysfunction, I want you to be concerned about osteoporosis because it's happening, as I showed you, even in young people, not just our postmenopausal and older adults. So that's the first piece. But what about the nutrients? we need a lot of different nutrients to build bone. Bone is not just made of calcium. And if you try to build bone out of calcium, it's going to be like that piece of chalk where if you drop it from a couple of feet off the floor, it's going to shatter. We don't want bones like that. We want bones that bounce. We want bones that will allow us to have a fall and recover carefully or easily. So just some advice here on nutrients and musculoskeletal health in general. We want foods that are very high in phytonutrients. We want to eliminate pesticides. We want them to be really high in the healthy omegas. Obviously, I would say any patient I have who has osteoporosis, I want them to be gluten-free because I don't even want to take the chance that gluten's interfering with their absorption. And we want them to eat whole foods, foods that are not processed, anti-inflammatory foods. And you always want to do a variety of foods. And I have this saying called variety confers stability throughout this talk. And if you just kind of remember that, I've got to continue to do a variety of exercises, a variety of foods. I can usually meet all my needs. And the reason you need to do that is because look at all these nutrients that are necessary. All of these are essential to building bone, and there are more. This is a shorter list. If I eat the same things all the time, there's a good chance I'm not going to get all of those nutrients. And then when you're thinking about hormones, this is the other piece that helps us build bone and maintain our bones. Look at all the hormones that are involved. And again, this is a shorter list, but some of the major ones are going to be estrogen and progesterone. Now you understand why most women will experience osteoporosis around the time, their first evidence around the time of menopause. Now, even a loss in testosterone can affect women and men, because one thing in general, it also helps us build muscle mass, bone. We talked about cortisol. Cortisol actually reduces calcium absorption from the gut, in addition to inhibiting osteoblasts. And osteoblasts are the builders of bone. The osteoclasts are the bone, or the clearers of bone. I'm saying it that way so you can remember it. Osteoblasts for building, osteoclasts for clearing out old bone. Thyroid hormones. If you have too much thyroid or too little thyroid, both of those can actually lead to osteoporosis. Parathyroid hormone disruption is another cause of premature osteoporosis. If you have too much PTH, that can also cause us to pull bone or pull calcium out of the bone into the bloodstream. And that growth hormone is important because that helps us maintain muscle mass and stimulate osteoblasts. And we're going to move on to some of the saboteurs, things that we do to ourselves that sabotage bone density, like eating high protein and high acid foods. That will make our body want to pull calcium out of the bone. So we want to eat more of an alkaline diet, like we were showing you earlier, with lots of phytonutrients, lots of vegetables. Coffee is such a major bone saboteur. It's going to cause us to leach out a lot of our minerals, and we spill those into the urine. Sugar has multiple ways of inhibiting bone density. Alcohol, we talked about that as well. Stress almost like stress is like giving yourself constant cortisol. And we know that it's constant steroids. So we know that steroids inhibit bone density. And then sodas have phosphoric acid. And so when you're drinking sodas that contain phosphoric acid, you're actually pulling calcium out of your bones as well. And then we talked about the medications. Now, stimulating bone growth is very important. And most of us now, because of computers, have sedentary jobs where we work a lot of times just in a seated position. And those that are bedridden, for example, they will lose up to 1% of bone mineral per week. That's dramatic. And think about it, we're almost bedridden nowadays, especially with COVID and everything else. So you want to really incorporate some weight-bearing exercise, because that's going to help you gain bone density. Now, you have to have all the pieces of the puzzle. You can't just do bone density exercises and not have all your right raw materials and continue to drink coffee all the time. So you have to kind of put all this together. But exercise that strengthens bones and also improves balance is going to help keep us from falling in the first place, which is our ultimate goal. What types of exercises, though? You really want to do some static exercise, but also some dynamic exercises. And it turns out in the research, it's not just walking that improves bone density. You have to actually walk fast, jump, jog, or run. Now, for some of you that already have osteoporosis, you're not going to want to, you cannot fall, so you may not start off with jogging or running. But for those of us who don't, these are the kinds of exercises we want to maintain so we don't get osteoporosis. You also want to vary the routine. And remember, variety confers stability when it comes to exercise as well. You want these exercises to be weight-bearing against gravity, because you'll find that cyclists and folks who swim in a pool, while it's fantastic exercise, it doesn't always help you build bone density. So you have to kind of investigate the kinds of exercises that you're doing. Remember to stretch, because that maintains flexibility, and the flexibility, again, is going to help us from breaking bones. It's while it also can also improve, particularly in the back and in the vertebral spine, stretching and posture have a lot to do with maintaining those bones. You want to do balance work, posture, be careful of extension and flexion. So in our older patients, and as you get older, if you do have osteoporosis, you don't want to be doing, what we think about with the back bend, right? You want to keep the back straight. You don't necessarily want to hunch over where you can actually sort of, put yourself at risk of having a fracture. And when you work with, as you know, as physical therapists, you want to make sure that you're working with a physical therapist or a Pilates instructor who understands about osteoporosis and has been trained on the correct exercises to give to us and our patients. Okay. And this was a great article, and I've got the research here if you want to look this one up. It's a recent article that showed that exercise is really important during adolescence, because most women will build the majority of their bone mass by the age of 20, 21, 22. And so a lot of our girls that are not exercising, a lot of our girls that are dieting, they're setting themselves up for osteoporosis down the road. And so I love this article. It's got a lot of information in it about the types of physical activity and how we can get started early on our children, on our friends' children, and on ourselves, and staying healthy so that we do not develop osteoporosis. So the ultimate piece is not just to make us have strong bones, but also to prevent falls. And so these are some of the conditions that put our patients and ourselves at risk for falls. And so if you have any patients that have these kind of conditions, you need to already be thinking about bone density, even if they tell you they don't have osteoporosis, because they have a risk of falling. The stakes are much higher for them if they do have osteopenia and osteoporosis. And you want to get started early. If you want to heal osteoporosis naturally, this is not something that you do in the ninth inning at the bottom of the with 2 outs. You have to get started very early for this. And so and then again, we're seeing certain medications our patients are on. Those put us at risk. And then think about even in your own life and in your home, making sure that the home is not full of opportunities for falling. So make sure that you have really good lighting. In my patients, I usually have them balance on one foot with their eyes closed versus with their eyes open, just so they can see how much better they are with their eyes open, and let them practice this and really give them the impact of knowing that having good lighting, particularly for those of us who get older and we have to get up in the middle of the night to go to the bathroom, we really do not want them falling in the middle of the night. And those can happen. So I can't tell you how many people have tripped over a cat or a dog and broken a hip. And I love animals, but they are a tripping hazard. So for you to remember all the things for you to do to help prevent osteoporosis, I made a mnemonic so you can remember these. And the most important thing I always believe really is the gut, because what good are the medications and what good are all these healthy foods and all these nutrients if you can't absorb them? So make sure the gut health is capable of absorbing the things that you want the patient to take in, or what you want to take in. Make sure you're getting all of the right raw materials. Make sure that hormones are optimized. You don't want to have hyperthyroidism or hypothyroidism. And then all the things that we do, watch out for those bone saboteurs, okay? We need to withdraw them from our lifestyle, because they will impact our ability to continue to create bone as we get older. And I'm telling you, as we get older, all of us really are at risk, because a lot of these things can happen. We want to stimulate bone growth and maintenance, and we have to learn the right exercise to do that. And we want to work on balance and fall prevention. The last piece that I've more recently looked at is also B stands for blood flow. So if we're not getting good blood flow to the bone itself, then we're also not going to be able to carry the nutrients to the bone. So that would be my second B on Grows B's. Okay. Now, what about the joints? If we can have healthy bones, but if we don't have healthy joints, the bones aren't going to do us quite as much good. So same kind of things do apply, but it's a little bit different. We want to go on an anti-inflammatory diet. We want to make sure that we might consider even going on the elimination diet, so that we're eliminating those inflammatory foods. Now, if we continue to have joint pain, if we continue to have pain in general, even in our muscles, we might do some food sensitivity testing. We might check out the gut, because we know that leaky gut can lead to autoimmune disease. And there are certain organisms that are related to autoimmune conditions that can damage our joints. We want to be sure to move now and to move often so we can move later. And I want you to think about that. If you're not moving now, you're not likely to move later. And we've got to get adequate sleep, and we've got to rest so that we can heal our tissues after we've had a hard workout or after we've had an illness. So sleep and rest are very important. Think about some of the supplements that can decrease inflammation and actually might even provide some joint repair. Things like turmeric and spent hops and omegas and your SPMs, your boswellia, ginger. Okay, so the next thing I want to look at here is maintaining muscle mass and strength. It turns out that as we get older, there's less absorption of protein, less growth hormones. We're going to be more sedentary. And as you get older, you have many more sleep disturbances. So those are the things that are working against us. So, but we can help our patients and help ourselves by making sure that we're getting enough protein absorption. Again, going back to the gut and looking at those branched chain amino acids, which are so important for maintaining muscle strength. And some of our patients, as they get older, you really want to, if you have the opportunity to look at some amino acid levels, you want to really hone in on these, because it's natural for us as we get older to have sarcopenia and lose muscle mass. So make sure that they're absorbing those particular ones. And then we got to evaluate those hormones. We got to make sure we don't have too much cortisol. We got to make sure that we don't have too much or too little thyroid, and make sure that our hormones are in balance. So you're seeing a theme and a trend here. Many of the things that help the bones also help the joints, and they work together. So move and lift, vary your routine. We want our patients doing aerobics, but we also want them to work a little harder in building muscle, because those muscles are going to support those bones and those joints. Now, what about arthritis? What can we do about arthritis? Well, it starts back in the gut. So the gut really has an impact. Infections in the gut actually have been known to be associated with certain autoimmune diseases for a long time. And many of those are the ones that affect connective tissue, like around our joints. And it was Alessio Fasano who kind of put this together, where there was a genetic predisposition. There's a triggering agent, which, for example, could be gluten. And then there's intestinal permeability. When you put those three things together, you have a perfect recipe for autoimmune conditions. And so if we dial that back and go back to the beginning, we can't necessarily remove the genetic predisposition, but we can investigate it to see if we have that genetic predisposition, and then try to rule out and try to eliminate triggering agents, and also investigate whether there is intestinal permeability and heal it. So when I was in medical school, I had to learn these particular infections that were associated with autoimmune disease. And it's sad because today we don't even, it seems like mainstream medicine doesn't even care about that knowledge. I had to know that to pass my boards. Nowadays, we just put everybody on a biologic. What if we went back and looked at the gut and said, hey, what if we have this infection? Maybe if we clear the infection, is there a chance that we could reverse the autoimmune disease? And I'm going to tell you, I've done that in my practice, and it does work. It's important to do it early on, though. You got to do it early on, because once the horse leaves the barn, sometimes it's really hard to correct and to completely eliminate an autoimmune disease. Nowadays, we know there's a lot of other bacteria that are associated with different types of things. And you see rheumatoid arthritis in every single one of those. And this is even a short list, because we know H. pylori can play a role. It's pretty well documented in things like autoimmune diabetes. And there are other viruses that can play a role in being the trigger in autoimmune disease. So doing a good gut assessment can also help us maintain and prevent autoimmune disease. And how does this work? Why? It's because of molecular mimicry. So if you see down in the bottom left, you see that this is an antibody, and that antibody has receptors. And unfortunately, that receptor could read or be attached to gluten or casein, which is found in milk, or thyroid tissue. So now you kind of understand why we, many times in our Hashimoto's patients, we go ahead and take them off of gluten and casein, because the body can engage in this sort of confusion of molecular mimicry. And I'm going to go into this a little bit more. But what are the triggers? What are the triggers that damage the gut in the first place, so that food gets across into the bloodstream and confuses us? Well, the triggers for autoimmune conditions are as follows. And I'm going to give you a mnemonic again, so you can kind of remember this. But before I reveal that to you, I want you to see all the different ways, all the different autoimmune disorders. And this is a slide that comes from Aristo Vajani, who does a lot of work in this area. And you're going to see that a lot of the conditions that our patients have, and a lot of the patients that you see, are related to autoimmune disease. What if we could dial it back? And I want you to think about this. You can remember this. I like to use the mnemonic STAINED, because it helps me remember everything. When I see autoimmune disease, I want to see, is there stress going on, which is the gut lining? Is there a toxin that could be the trigger? Is it an allergy? Is it an adverse food reaction? Could it be an infection? Is it just the simple lack of a lot of nutrients that we need that's triggering this particular response? Or is it an excess, like alcohol, that damages the gut lining? Is it an excess of other things that can damage the gut, or excessive drugs, for example? And again, don't forget the digestive disorder. So digestion is really important in looking at the root cause of autoimmune disease. And how does it work? Well, we are born with tight junctions. When those tight junctions get damaged, then things that are floating in the lumen of the gut, which would be at the top of this picture, can get across and into the bloodstream where it says immune system activation. So the top is the lumen of the gut, where you see the food antigens, you see lectins, you see bacterial toxins. If we've damaged the gut lining so that those tight junctions are open, then these potential triggers can get in, and look what they can do. They can actually activate a T lymphocyte, which now goes after our own tissues, possibly if there's molecular mimicry, or it can even go in and damage things that are important to us, like our neurons. And then again, looking at that molecular mimicry. So with autoimmune disease, don't forget the gut also includes the mouth. And that's why, and could be why, if you might think about it, cardiovascular disease could actually be an autoimmune condition in a way, because all those bacteria that we get exposed to every time we eat and chew something, they're going to get into, whether we like it or not, into the mouth, because the mouth is where absorption actually starts. And if we've got damage like leaky gums, which is, again, think of leaky gums as intestinal permeability. It's just that it's starting in the mouth. When they get across and they get into the bloodstream, think about that. That's where you can have autoimmunity in their joints, autoimmunity in the promotion of atherosclerosis and cardiovascular disease, and ultimately even damage to our brain. And that's one of the reasons why the mouth, keeping the mouth healthy, keeping the gums healthy, is one of the first places you need to start. And I want to be real clear with you that if you're evaluating the gut and you're not looking at the mouth, you're only doing a portion of the job. You're doing a halfway job. And this is an interesting slide. And I want to fly through it real quick, but just show you how fascinating it is that in countries where they still have a lot of worm and parasite infections, but I'm thinking mostly of worms, those worms actually help keep the immune system stable, help keep it schooled, if you will. And so you will see that there are some physicians that actually use worms in a controlled way to actually help reverse autoimmune disease. It sounds crazy, but look at this. This is an association between the infestation of helminths and the lack of autoimmune disease. It's almost completely perfect. Those of us who don't have helminths tend to have more autoimmune disease. It's unbelievable. This is another great slide from Aristo Vajjani, which shows that the proteins, if you think about the protein is made up of all these different chains of amino acids. When we use food colorings or dyes, those are like those red and blue little markers on top of those amino acids. Our bodies are our digestive enzymes are supposed to cut at certain areas of amino acids. You know this from enzymes, right? So if there's a cysteine next to a thymine, then you're going to cut between the cysteine and thymine. But if we have a food dye or a pesticide or something binding to our proteins, then our enzymes don't break them down the same way. That's the reason why if you eat a blue candy, your tongue turns blue. Your body can't wash that away. It's going to take time for those to finally go away. So colored dyes are very damaging. It doesn't allow us to break our food down in the proper way that they've been doing for 300,000 years. Aflatoxins from molds, which come from a lot of grains and a lot of our foods that are stored in large quantities, like even coffee and tea, they can have aflatoxins. Anything that grows under the ground can have aflatoxins because there's mold in the ground. All of these things, when they bind to our proteins, it doesn't allow our digestive enzymes to break things down appropriately. And now we have these big strips of amino acids that unfortunately sometimes look like our own tissues. They stimulate the T cell, they engage in molecular mimicry. And now you can see how those kinds of foods can also add to autoimmune disease. And remember, we always want to reduce inflammation to protect our joints. I don't like to give people supplements. I have a reason for it. So I always like to say, if you have someone who already has inflammation, despite eliminating their inflammatory foods, you can kind of help them along with some of these great products that nature provided us to prevent inflammation. And this drives me crazy. And I want to show this for breast cancer and why they're celebrate and to encourage breast cancer awareness makes no sense to me. We should be doing berries and vegetables and not dye-laden sugar, which is just, again, cancer's favorite food. So how do we remember all this? I'm going to make it easy for you. Go back to what we talked about before. It's desire. Remember, diet, exercise, sleep, and rest, intestinal health, which is incredibly important, and also our relationships and stress reduction, because our relationships can sabotage us as well. They can make us do things that we weren't doing. They can get us off of our path of healing, or they can encourage us to stay in our path. And we'll talk about that a little bit more. And then once you've done those foundational things, then if you need supplements, we add supplements. So I'm going to give you a quick case history of RL. So RL was one of my patients for a long time. He's a 52-year-old male with hypercholesterolemia, anxiety, low testosterone, and he's overweight. He's about to be placed on a statin. Now we're getting ready to talk about cardiac again from the picture before. So we're going to talk about our last of the three things we really want to keep healthy so we can make our way into old age healthy and functional. We've got to keep our heart healthy. Well, these were his labs before. So you can see he's overweight. He's BMI is 25. He's got really high LDL. He's got an ApoB that's high. Remember, the ApoB is the protein that's attached to LDL. So it kind of reflects the LDL particle number. And you can see that reflection there. He's got a lot of small LDLs. Look at his small density LDL. So he's not looking too good. And you can see why his other doctor, who's a friend of mine, I went to medical school with him, is threatening to put him on a statin. So he comes to see me and says, I don't want to go on a statin. So we started working together, and I want to show you what he was able to do. But before we get started, I want to show you how we really used the desire technique. So from a diet, we worked on his diet first and foremost: no sugar, no gluten, no dairy. We had him exercise just 30 minutes a day. He wasn't really doing much of anything. And then he had good sleep. So we didn't have to work on his sleep. Sleep was not an issue for him, but we wanted to check that off and make sure that wasn't an issue. And then we did start working on his gut. He was on a gut restoration formula, which had a lot of anti-inflammatory agents in it, and also helped make sure he didn't have leaky gut. And he did not do a stool test because financially couldn't afford it, but we didn't have a reason to do it, but we went ahead and addressed it. We had him reduce his stress and his relationships. And then eventually we ended up, based on that, we went ahead and said, we're going to give you a little bit of niacin instead, because he did have, that's really good for LDL cholesterol. So we did that. We just did a small amount, very small amount of niacin twice a day with food. And we made sure that he was on his omegas. Look what he was able to do. So this is without statins. I mean, he did lose some weight. If you can see from the top there that he did lose about 8 pounds, and dropping his BMI. And you can see that he still has a slightly elevated small density LDL, but it's not in the 60s like it was before. And his LDL is very appropriate at 1100. Look how great this is. So he was able, and he's never had to been placed on a statin. And now his doctor's happy too, his other doctor. And so when we're assessing lipids, in standard protocols, just to look at the total cholesterol, the LDL, but what I'm going to teach you in some other lectures as well, and what you've probably learned also, from the teachers through Garrick's program, is, to look at the LDL particle number, the small LDL, the HDL particle. This is a number of HDLs. The type of HDLs, the HDL2Cs, which are the big fat ones that really are the mover shakers of the HDL world. We want to teach you about ApoB and ApoA1 and why that ratio is important. Also about Lp(a), which is a genetic marker, which in some cases can be changed, but mostly is genetically determined. And then also whether or not your LDL is oxidized, because that's damaged LDL. All right. When it comes to cholesterol, size matters. So here are two individuals. Now you can see they both had the same cholesterol level, right? They said the same LDL, but one of them has big fat ones and has a low particle number, and the other one has a whole bunch of tiny ones. Okay. And so their particle number is going to be high. But notice they have the same LDL. One has a different pattern. So it turns out that the big fat fluffy ones, the big balls, the bowling balls that you see over there on the left, are actually at a much lower risk than the small little bullets on the right. And so that's why just looking at your regular, just standard lipid panel is not going to cut it when you're trying to look at reducing cardiovascular risk. And if you have only had that done, then you need to go ahead and think about having, taking a little bit of extra money that you have and go ahead and do a more advanced lipid profile. All right, I want to talk a little bit about metabolic syndrome, because a lot of our patients have this and no one's diagnosing them with it, and it's a huge risk factor. And it turns out, I love this statement because it turns out that metabolic syndrome, we think, is really a manifestation of the mismatch between how we were from evolution's time, how we were designed a long time ago for a certain environment, and how we're now mismatched the environment that we live in now, where we eat processed food, where we have Uber bringing us food. We don't even have to go out and hunt it. We have brought to our house. We don't even get in the car. It comes right to our house, and we're not moving as much. We're not exercising as much. So I don't, for those of us who are my age, when you ever watched a program called What's Happening, if you remember that there was a great really funny actor in that group called Rerun. And we always thought he was really fat. Oh my gosh, this guy is so fat. Rerun was so fat. And he had his friend, I think his name was Rob, but he had his friend, and he was really thin. So you had the thin guy, and then you had the really fat guy. And I mean, we always thought, gosh, Rerun, oh my gosh, he is so fat. Well, let me show you a picture of Rerun from that show, and it blows my mind. What we consider fat today is different from what we thought about even back in the 70s. This was a 70s show. If we saw Rerun today, we would say, oh yeah, he's a little overweight. We have become conditioned to so much obesity in this country now that when we see people that are Rerun size, we don't think of them as fat anymore. We say, oh, you probably have to maybe lose 10 pounds. But the reality is this is a dangerous situation. Metabolic syndrome, it increases all-cause mortality and cardiovascular disease. And we got to start being honest about it and quit worrying about hurting people's feelings. I mean, not letting people know that they are putting themselves at risk is just kind of stroking their back while they're going right to the grave. And we are the frontline people to help with that. And we have to also be honest with ourselves. If we're putting on this kind of weight, we have to start getting serious about it and find ways that we can, shrink our waist size and start working on some of these. And I want to show you a little bit about this. So metabolic syndrome is associated with all these increases. And that's probably why there's an increase in mortality, which means death, and particularly cardiovascular disease. But you also, even if you don't die from a heart attack, you can also have problems like non-alcoholic fatty liver disease, peripheral artery disease, and then nerve damage, retinal damage, so you can't see. I mean, these are not things that people want to experience. Get rid of those. Okay. And so if you want to make the diagnosis of metabolic syndrome, you're going to need some lipids. All right. You're going to have to do some lipids. But the first thing you can do, and this is something you do on yourself easily, and certainly with your patients, go ahead and do a waist to hip circumference. I know you guys learned this before in some of Garrick's lectures, but if you haven't done it on yourself, be sure to do it on yourself. Do it on your loved ones. Do it on your patients. So if you only need you only need 3 of these to make the diagnosis of metabolic syndrome, and then you're in that category. And one of the ways that I remember, I use a mnemonic called SLOTH. So S stands for your sugar level. L stands for you want to have, what do I use L for? L is for your blood pressure. Is that right? L is for, O is for your waist, obesity, waist circumference versus hips. T is for triglyceride, and H is for blood pressure. So yeah, so L is for low HDL. Okay, so S for sugar, L for low HDL, O for obesity, T is for triglycerides, making sure that they're not too high, and H is for hypertension. So that's how I remember all 5. All right, and it gets a little tricky when you have different ethnic groups because they have a different circumference. So if you have smaller bones to begin with and you're shorter and what have you, like some Asians, not all, but some, then you're going to have different cutoffs for what's considered to be the waist circumference being too large. All right. So you want to ask yourself, have you ever measured your waist? Have you ever measured your waist to hip ratio? And then the other piece to look at is your bioelectrical impedance analysis. So when you've been trained through Garrick's program, you're going to know that it's not just about waist to hip. You also have to know how much body fat you have. But this is a great screening test that you can do in the office very quickly on your patients. And then you yourself should be doing it and keeping track of it, because we don't want to slide down that path of cardiovascular disease if we want to stay healthy and have a great retirement. All right. What are the risk factors for cardiovascular disease? Now, this is how I break them down. These are all the modifiable risk factors. And if you have a 6th one, let me know. But these are all things that we do have some control over. And each of these plays a role in strokes and heart attacks. Okay. So what can we do to reduce them? Let's go back to that whole desire technique. Start with food, diet. These are some of your your cholesterol lowering foods that you can add to your diet and really promote these with your patients. Remember that if you are an overproducer of cholesterol, when you use your plant sterol and stanol spread, sometimes that can reduce your cholesterol as well. And the Mediterranean diet has great benefits. And now you understand why, because it's going to look how it's set up. It's lots of fruits and vegetables. And I like how this particular slide, this particular one that comes from Old Ways Preservation and Exchange Trust, shows you that the base of our foundation should be our relationships. It should be activity. It should be going into a state of gratitude before you eat so you can properly digest your food. And these people eating family, I would imagine they probably said a prayer before they ate so that they could be in a state of gratitude so they can properly digest their food. They're not eating in front of a desk. They're not eating on the run. They're eating together and having a relationship. These people are going for a walk. These kids are playing. People are dancing, having a good time. So that should be our foundation. Think of activity on our pyramid being in our relationships and sleep. And then these other things are set up from there. And the Mediterranean diet benefits, there's lots of research on the Mediterranean diet, and these are some of the chronic conditions that it's been shown to prevent. Okay. And color your plate, put all the colors in there. I left one color off here, which was yellow. I'm kind of including it into the orange, but each of those colors has a superpower. And so if we don't engage in variety of food and diversity of food, then we're missing out on certain superpowers that our body just might need. And this is a list here for you. Remember, variety confers stability, variety in exercise, variety many times in relationships, but they got to be, supportive. And then also in our food, lots of colors. Okay. You also want to evaluate for blood clotting risks, because blood clots are oftentimes what leads to the heart attack or stroke. And so you can do that through family history. You can do some genetic testing looking at factor V and prothrombin, and you can also, a great test called Aspirin Works is a test to see if somebody's on a baby aspirin, if the aspirin's actually working. There are some people that genetically the aspirin doesn't work for them, so they think that they're protecting themselves when they're not. And that's a great test. It's a urine test. Look at the fibrinogen levels. If those levels are high, that's a conversation that you want to have with yourself or with your loved one to make sure that we bring those fibrinogen levels. That's the precursor to a blood clot. And so when you're thinking about those modifiable risk factors, that's one of the ways to avoid that. Also, these are some of the things that can lead to blood clots. And these are things we want to try to modify in our lifestyle. And then some of the foods that tend to prevent it are listed there too: turmeric, omegas, even a low dose aspirin. If you don't want to use aspirin, you could use I know Zymogen has a product called Salix, but basically it is a natural type of aspirin. You can also use nattokinase, which is fermented soy. It doesn't have soy in it, so you could just do the nattokinase itself could work. Okay, and remember, salmon's great in high omegas. What about foods and endothelial function? So it turns out there are certain foods that improve endothelial function. And I always want to think about beets, for example, but those high citrulline and arginine foods really help us make more nitric oxide. Again, looking at fish and nuts and omegas, all of these foods, including red wine, are really great for endothelial function, including dark chocolate. Turns out that those of us who are eating trans fats are setting ourselves up. So that's something we want to avoid. We want to add those other foods in and get rid of all these high trans fats. Trans fats actually greatly increase the risk of coronary disease and a better chance that the person's going to die if they do have coronary disease. Those trans fats are very dangerous. And some trans fats, believe it or not, are natural. So you're going to have some sometimes in your patients, but you really, all the ones you can avoid are in all these processed foods. Okay. And red wine, believe it or not, has a lot of benefits. It has polyphenols that help prevent cancer, cardiovascular disease, neurodegenerative disease. It's an antioxidant, improves endothelial function, and it suppresses an enzyme that actually accelerates atherosclerosis. Now, remember, this is a balance. We just got done talking about osteoporosis. We don't want you drinking too much wine. In the research looking at alcohol, one of the papers that I looked at said, as long as you had 29 or less drinks a month, you probably were not going to significantly contribute to osteoporosis. Now, everybody's different, but that's on average. That doesn't mean 29 at one time. That's 29 throughout the month. So I just try to tell people, a couple of drinks a week is probably fine. But red wine does have that extra benefit. Now, it's not all red wine. It tends to be the more bitter red wines. And it turns out too that some of the older wineries are the ones that actually are better because they haven't been using pesticides. They're, if you've ever spoken to an Italian, somebody working, some of these older Italians, you can't teach them anything. And they are definitely going to say that they've been doing the wine this way for 200 years and this is how we're doing it. That's probably some of the best wine to get because they're not going to be using pesticides. And some of those bitter wines are actually the ones that are better for doing the benefit that we need. Okay. Chocolate, again, the darker the chocolate, the better, but chocolate itself is an antioxidant, reduces LDL oxidation. Remember, we don't want damaged cholesterol. Oxidation is one of those risk factors. We can decrease oxidation through our phytonutrients and also from dark chocolate. Exercise is incredibly important. So in the British Medical Journal in 2016, they actually listed all these different chronic conditions that are helped by exercise. And why does it work? I'm not going to read these to you, but it does a lot of good things. I always think of exercise as a mitochondrial aphrodisiac because it helps the mitochondria create baby mitochondria. So you want lots of mitochondria, which is really healthy for you. Okay. This is at the top of Mont Royal in Montreal, which is the mountain that's right outside Montreal. And we rode our bikes up there and had a fabulous time. When you do things together, it's more fun. And you can walk. Walking is fantastic. Believe it or not, walking actually has a benefit for cardiovascular risk and all-cause mortality. Now, it is in this study particularly, they did show that the lowest mortality rates were if you walked 3 to 4 hours a week. Those were even better. But they were actually able to show that just that they were able to prevent 1 death for every 61 people who walked 2 hours a day. And then also, if you work at least 2 hours per week, you get a 34% risk reduction in cardiovascular mortality and 39% risk of all-cause mortality. And I think that that's really for people that walk 2 hours per week. Okay. But what about over-exercising? That actually, believe it or not, is not a good idea either. So you want to do moderation. When I think of exercise, I think of moderate exercise, because if you exercise too much, you can actually create a chronically elevated cortisol. And we just got done saying that too much cortisol is like taking steroids as far as your bones are concerned. All right. We know that stress is hard on the gut. And this is probably why a lot of marathon and endurance athletes do have gut issues. Now, I'm not saying that every single one of them. Some people are genetically just designed in a way that they can do it and it works out great for them. But in our vast majority of people, you don't want to overdo a good thing, right? These are just some of the reports that the studies show that in addition to the chronic elevation of cortisol, it also increases inflammatory and prothrombotic markers. It can depress your immune function. It can increase inflammation, oxidative stress. And then in some of my subsequent lectures, I'm going to talk about some of the recent research that shows that there's sort of a U-shaped curve. There's a certain point at which you actually damage the heart by exercising. And we just have to find that place for each of ourselves and for our patients. But not exercising is clearly not a good idea either. Something in the middle there. All right. Sleep, incredibly important. Getting back to that desire mnemonic, we're talking about cardiovascular disease. Sleep's incredibly important because we've got to evaluate ourselves and our patients for sleep apnea, because sleep apnea is associated with hypertension, drops in testosterone, and cardiovascular disease. And we have to get enough sleep. It's really one of the first steps in blood pressure control. We got to increase the duration, improve the quality. We need to decrease disturbances in the middle of the night. So some of your patients will tell you why they're waking up. We got to figure out why. We got to reduce that. Okay. Caffeine can play a terrible role. And again, we talked about coffee as being a bone saboteur. Small amounts of coffee are probably fine, but you got to get that coffee early in the morning. And you got to make sure that the patient doesn't have genetic SNPs that make them unable to eliminate caffeine. So that's another piece that you can use when you're doing genetic testing is, again, personalize the amount of caffeine to the individual. And we should probably moderate and eliminate alcohol because it does cause sleep disruption. This is another case I'm going to try to run through as well. This is an amazing case. I actually saw this patient yesterday in my office, which was kind of cool. She's doing great. She just was coming in to pick up some supplements. So this is the connection between intestinal health and cardiovascular disease. It's a patient who was presented to me with SIBO. That's why she came in. She knew about SIBO. She had SIBO. She's trying to treat it herself, but she couldn't do it. She came in to see me. She's a 39-year-old with gas and bloating. She had weight loss, hair loss, and she also had really severe pain in both of her feet. History of gastroenteritis for three different episodes of gastroenteritis. And that's what you'll hear a lot with SIBO as well, is that there's some kind of triggering event, and then they kind of get this SIBO that they can't get rid of. And she did have a strong family history of cardiovascular disease, but this is not her, but a woman that could be her because she was slender and slight and definitely not overweight at all. Okay. So she underwent some food sensitivity testing. We did stool testing. What we found is she had really low pancreatic enzymes like many SIBO patients. She did have an anti-gliadin IgA. So we took her off of gluten, and she did have a sensitivity to eggs and a couple of other things that we, sort of helped create her own elimination diet. I wanted to rule that out for sure. Because again, if we're going to heal the gut, we can't keep having something that's disrupting the gut lining. So on her original advanced lipid panel, now this blew my mind because you're looking at this slender, very healthy, very well-educated. She knows a lot about health. Like I said, she probably wouldn't have seen me if she hadn't gotten been able to get better on her own, but she's really a healthy person. Look at that LDL particle number. And even sadder, look at the size. She does have elevated small density LDLs. So not only does she have a lot of particles, they're the wrong size. She's a really high ApoB, which again, I'll teach you guys more if you don't already know it, but about how ApoB relates to the LDL particle. And then look at our LP little a. The LP little a is we call that sometimes the Grim Reaper because it is really dangerous for cardiovascular disease. Not everybody has it. You can't usually fix it. But in this case, I'm going to show you how we were able to fix it or how she was able to fix it. But more concerning to me than anything was the vascular inflammation. So she has that elevated LPPLA2, and that's actually sometimes implicated in a plaque that wants to get ready to rupture because that's an enzyme that's found in her bloodstream. It's not supposed to be in her bloodstream in high levels. It's supposed to be staying in the plaque itself. So the fact that it got out into the bloodstream means this woman might even have a plaque that's about to rupture, is starting to leak and start to rupture. All right. So we need to get busy with her. Now, did I put her on a statin? No, I didn't put her on a statin. I came in and treated her for what she had, which was in general her SIBO. Now, I also want to point out that look at her HSCRP. It's not real elevated. So that's the thing that's sometimes tricky about SIBO. We always think that SIBO is a terrible condition, but it's not. It's too much bacteria in the wrong place. It's not like she's having tons of inflammation in her gut per se. She's got it in her vessels though. So we've got to do something about it. So we treated her for SIBO, and then 3 months later, is that right? Yeah, we treated her in March, and then I guess this is actually July. So 4 months later, look at her levels. And I didn't even treat her for cardiovascular disease. I didn't give her a statin. All we did was work on her SIBO. And I almost didn't believe that the labs were that they even made sense. I couldn't even believe this. So when I did a lot of research, we found there's a lot of research that shows that SIBO is associated with elevations in your lipids. Okay. So when next time your patient comes in and they have really high lipids and they also have SIBO complaints, you don't necessarily have to rush to put them on a statin. And I guarantee you, if she'd seen any other doctor, the first thing they would have done was put her on a statin. And she didn't need a statin. She needed her gut looked into. So that's why that desire mnemonic is important, because I is a really important part of cardiovascular disease. Okay. I'm going to show you a little bit more about that as well. Now on this test, her HDL particle number did drop, and you will see that sometimes because the gut is the body is smart. It's going to make more, and a healthy person will make more HDLs when you have a lot of LDL because it needs to clean up that cholesterol. So that level dropped, but everything else. And look at her LP little a. That blew my mind that could actually get corrected, because I'm taught that doesn't get corrected. Now her LPPLA2 dropped as well, but then I'm going to show you what we did do, because I did want to try to bring that LDL particle down, and I wanted to bring her HDL particle up a little bit. So I put her on a little bit of niacin, just a tiny bit of niacin we added. And then the next time, look what happened. Our HDL particle number went up, which niacin is known to do. A little bit of an SDL that went up a little bit, but you can see, look how great her cholesterol now is. And she's continued to do well. In fact, a couple of years later, she came in and we were just doing some routine lab testing, and her cholesterol went up a little bit. And I looked at her because she was really coming in to discuss her daughters and not herself. Like many moms, she doesn't, she's not looking after herself. So I said, your cholesterol is higher. I said, are you starting to have SIBO symptoms again? And she looks at me, she nods her head. She says, yes, I am. So we just go back to treating the SIBO, which can come back, and the cholesterol straightens itself out. And she's been doing great. Okay. So inflammation's role in cardiovascular disease. Trimethylamine N-oxide is something that the Cleveland Heart Labs use, and that's actually made in the gut. It's literally made in the gut, and it's been shown to be associated with risk for cardiovascular disease. There's your LPPLA2, which is a marker of vascular inflammation, HSCRP, your myeloperoxidase. Look at the white blood count. Don't forget the white blood count is another way of looking at inflammation. Ferritin is an acute phase reactant. And look at your albumin to globulin ratio, because albumin, if your globulin ratio, if it's very, very low, that means you've got a lot more globulins than normal. And globulins are immunoglobulins. They're inflammatory. They're a response to something going on, either a food sensitivity or maybe even an infection or even an autoimmune issue. And then F2 isoprostanes. These are all markers that you don't have to check them all, but they're all markers that can give you an idea about cardiovascular risk as far as inflammation. And why are they important? Because they play a role, as you can see from this slide from the Cleveland Heart Labs, they play a role in the progression. You can see there's the LPPLA2, where it's almost like I had a patient tell me it's almost like a pimple that sort of bursts. And the body, when they see this burst, the body says, oh my gosh, there must be a break in the dike here. We got better plug the hole. We don't want the vasculature to bleed. And then when you get your platelets come to react to this tear here, and that's the issue that's going. So we want to really kind of treat our cardiovascular disease over here, and not when it gets into this position. But even in her case, we were able to, stem the tide, and she obviously didn't have any cardiovascular symptoms. Don't forget about the mouth. So the mouth is dirty. Mouth is very dirty. And it's also the area where we're starting to absorb. So we have an incredible blood supply. You even flossing your teeth, you've noticed you get a little bit of bleeding sometimes, and that's a sign of gingivitis. But we want to make sure that the mouth is healthy because that's one of the inroads. It's part of the gut, believe it or not. And periodontal disease is absolutely associated with cardiovascular disease. I wanted to kind of show you this, how the poor lifestyle, the gut infection, the use of PPIs, that's going to change the gut flora. So this is sort of a progression. Okay. You're going to have increased permeability. You're going to have more LPS, which is the lipopolysaccharide of the linings of some of the bacteria that gets into the bloodstream. That increases endotoxemia, which is sort of a vascular inflammation, and that will lead to more metabolic disorders. Okay. So again, the intestinal health is really important when we're thinking about cardiovascular disease, and it's so greatly overlooked in our cardiologists. What about relationships and reduction of stress? So anger increases the risk of MI by 230%. And that's why you think relationships aren't important. They're important. And sometimes we have to remove ourselves from situations that create a lot of anger. In fact, those people that tend to get the angriest are the ones that have the highest death rates. It increases atrial fibrillation, increases ventricular arrhythmias. These could be part of the reason why this happens. And remember that just the perception of psychological stress shortens your telomeres, which are basically the links of your DNA, which is associated with longevity. Those that had the highest amount of depression actually had 40% more cardiovascular disease and a 60% higher death rate. So we have to replace that anger with relationships that are loving and spend time with people that we love being with. And this is a picture of my husband's family. And you can see here are the parents. They're both 92 now. In this picture, they were probably 89 or 88. They're surrounded by their family and their family's, spouses, and they're spending time together. And they're not fighting. They love being together. And this is so important for us, is to surround ourselves with loving families, okay? And loving relationships. What can we do with those loving relationships? Well, this is my best friend, and she likes to cycle. And I thought, well, heck, she has her own business as well. She's very busy. I think if I want to spend time with my best friend, I'm going to have to learn to cycle. Otherwise, I'm never going to get to see her. So we went cycling. This is on the coast of Spain. And so, we want to spend time with people that we can express and receive love and support from. We want to drive those anger feelings down. We want to feel that support. We want to exercise, preferably in nature. There's studies to show that that's actually very helpful as well. It helps us detox. If you don't want to exercise, I often use guided imagery. I try to imagine myself exercising and feeling good. It helps me get out of that bed and go do it. Guided imagery is very helpful. Meditation is very helpful. Biofeedback is great for reduction of stress. Prayer, don't forget prayer, and being in a state of gratitude is very good for the reduction of stress. And some of us have anger about relationships that have happened, things that have happened to us that were unfair. We have to reach a place of forgiveness. I have a saying that I love to use, which is called love anyway. Even though you're mad about something and you're not saying that what was done was correct, but sometimes you just have to kind of let it go and decide that you're just going to love that person anyway. Sometimes we can't be around that person because they hurt us, but we can still love them from a distance. Forgiveness is important. Turning it over, looking at something from a different viewpoint, that perspective change can be everything for us. And so sometimes you can't sort something out. We have to turn it upside down and flip it and reverse it, like Missy Elliott says, right? Flip it and reverse it. Look at it upside down and backwards. And maybe we can see that we can handle it better. Turning it over. More sleep, less caffeine, and practice effective communication, because sometimes there is just misunderstandings. This happens in texts all the time and emails. You sometimes just got to get on the phone or get face to face and read that facial expression if we're able to take our masks off. But read that facial expression so that we can properly communicate with one another, especially ones that we love. What about extras? So sometimes when you're thinking about cardiovascular disease, you want to make sure that the person has enough omegas because they're so helpful. Look at all the things that they can do that have been proven in the research. And they also increase endothelial function, which is that widening of the blood vessels when it's time to widen them, and shrinking the blood vessel down when we don't need to, like when it's cold or when we're trying to exercise. We want the blood vessels that go to our stomach, hopefully we haven't eaten something before we exercise, to divert that blood flow to our legs so that we can exercise, or to the heart when it needs it. So good endothelial function, healthy endothelial function is important. All right. So think about this. I was just showing you before all these modifiable risk factors for cardiovascular disease. It turns out that fish oil works on every one of them. So that's one of the extras that I think is, if you were going to give anybody something, I think fish oil is just a silly thing not to give. Even if people have fish allergies, if it's a very clean fish oil, and it doesn't have any protein and it's only the oil, they shouldn't be reacting, because allergies are a reaction to the protein. It's not the oil. Value for other extras. These are some ideas. I'm not saying you should take them. I'm saying think about them as possibilities. So omegas, all the things they do, niacin, what it can do. And I showed you an example of that. Lowers LPA, increases HDL, and it can also lower your LDL and the size of your LDL. Berberine has this activity. Be careful with berberine, because sometimes it also works in the gut. So sometimes it can cause gut dysfunction or a little indigestion or diarrhea. If that happens, maybe that person's not a candidate for that product, but many people do really well with berberine, as both for diabetes and cholesterol. Probiotics, or certain probiotics that actually reduce LDL. And that again is going back to the gut. Trans resveratrol, if you have people that are alcoholics, they can't drink red wine, then you might have them take, resveratrol itself. Red yeast rice is a natural statin. It does act like a statin. So if you give them, you do have to give CoQ10 with red yeast rice. Citrus bergamot's been working well for many people. I tend to see that it works best with niacin, but you can use that. And then green tea does a lot of good things. And so people could switch from their caffeine to their green tea as long as it's not old green tea and has mold. So how many miles? How many more miles are you planning to go? But even more importantly, will you enjoy the ride? And that's what you got to ask yourself. Go back to this desire. Look at these guys out here. Isn't this beautiful? Enjoying exercising, enjoying relationships, being out in nature. They're hitting all three really well. Diet, exercise, sleep, intestinal health, and relationships. And extras only if they're necessary. Sometimes we need pharmaceutical help. Sometimes we need supplements. And then always reevaluate. Get these people off these supplements and off these pharmaceuticals if they don't need them, or reduce the dose. Be fair to them. And then a sense of accountability. We've got apps out there. We've got coaches. We have partners. And you as a physician can track your patients as well as yourself. I'm going to run through this. Don't forget about diet. These are some little sayings I'm going to run through quickly that I like to say to my patients to help them remember things. I say, if it grows on a tree or a bush or under the ground, if it swims or flies or runs around, it's probably food. And foods that are high in sugar and starch are like eating without breaks. When you're eating out, there right now, lots of restaurants do offer low carb, gluten-free, and whole foods, and we should be out supporting them. They're trying to help others. I mean, that's where you should be spending your money. You should be spending your money with people that actually are doing things that help improve the lives of others, right? So go to those restaurants. When you're shopping, I like to think of myself as a hunter and a gatherer. I'm out shopping, I'm gathering. And when I'm exercising, I'm out hunting, I'm running. I'm using my DNA the way it was originally designed, okay? Buy organic, try to buy local. The apple that you find at the store that has the bug bite probably had the least amount of pesticides. So don't always bypass those and cut that piece off, or eat it and get some more probiotics probably. Check out the Clean 15 and Dirty Dozen. And I like to say to people, if it comes in a bag or a box, it'll put you in a bag or a box. And they always laugh, but they remember that. We shouldn't be eating things out of bags and boxes. We should be eating things that just got picked off trees or pulled out of the ground or plucked off a branch, right? And when you eat high insulin demand foods, you're directing your body to store fat, because insulin tells your body to store fat unless you're an Olympic athlete or you cycle as much as Garrick does, or you run, marathons. I always tell people, eat like an emperor, not a prisoner or a peasant. Prisoners and peasants eat bread, emperors and the rich, if you look at paintings, they always ate the most exotic foods, the most exotic meats from all over the world. So treat yourself that way. Treat yourself. And it's probably why those people were the people that had longer longevity than some of the poor people, because they just ate bread, and bread is not great for us. And whether you like it or not, it just is not a good choice. If God had wanted us to consume dairy, he would not have put horns on a bull. And this is a saying that I just made up, but it makes sense to me. We were probably not really meant to milk cows. I mean, bulls are some of the only animals that can kill us. Okay. There's not a lot of animals out there that can literally kill us, but a bull can kill us. It's very dangerous. And I know you're not milking the bull. I'm not an idiot, but if we didn't have a way to keep the bull away from the female cow, I bet you if you were out milking cows out in the wild, you would get gored by a bull. And if you consume milk products designed for babies, don't be surprised if you start looking like one. Things like this, corn is used. I had a patient who lost a lot of weight, and she told me, I said, how did you do it? I mean, you did such a great job. What did you do? She said, you told me that corn was used to fatten hogs. And every time I wanted to eat corn chips, I'd say to myself, I'm not going to eat hog feed. And she lost a lot of weight and looked beautiful. So you never know when these cute little things that you say to people will make a difference. And that's why I'm always coming up with new ones. I'm looking for that piece that's going to help, really the patient really change their behavior. Okay. All right. So I do say that if God was meant, if it was meant for us to sit all day, we would have had feet growing out of our butt. So I don't think that God really meant for us to sit all day. All right. He gave us feet so that we can move around and walk and what have you. Okay. I do want to bring up this idea of the daily movement versus the weekend warrior. We want our patients to do moderate exercise consistently. Remember that variety confers stability, not just don't do the same kind of exercise all the time. You've got to balance the body. The body can get out of balance. Use a physical therapist. You guys know this so well. Learn the correct way. Don't do it in a way that could damage or we could get injured. Remember that all the benefits of exercise. These are a few of them. Increases brain-derived neurotropic factors. Great for the brain. Improves hormones. Improves bone growth. So remember those things we were thinking about and how all of these desire items help all of them. Don't forget about sleep. Sleep's important for the brain. Sleep's important for the cardiovascular system. And sleep is really important for musculoskeletal system because it really helps us repair our tissues. It helps us build new bone. Okay. Don't forget about intestinal health. Prebiotics, probiotics, when necessary. Not everybody needs probiotics. If we have SIBO, we might not want to give them probiotics. We need regular bowel movements. If we're not having regular bowel movements, something's wrong. We got to investigate. And regular bowel movements really does mean a bowel movement every day, and sometimes 3 times a day, as long as they're not watery. We got to get rid of GERD. GERD's a sign something's wrong, and we need to investigate it. Get rid of bloating. Review the 5R program for ourselves and for our patients, so that we're not just doing a piece of the puzzle, but we're doing the whole comprehensive piece, so we can get full healing. Remember that leaky brain sometimes starts in the gut, and leaky brain needs to be corrected, and so that means we've got to correct the gut. Okay. We want to prevent the overabsorption of cholesterol, which sometimes can happen because of SIBO. All right. And this is a great connected picture of how the gut is associated with the brain, is associated with autoimmune disease, and even our emotions like anxiety and depression. And remember relationships. I wanted to go run a race. And so I invited for some friends of mine. They came along and we all ran the race together. So we can actually infect one another. Relationships can support or sabotage our health goals, but we can actually infect one another by building a community of health. So health can be a communicable disease, but not really a disease. It can be communicable. All right. And these are some of the things that are happening in our culture today. Like, cigarette smoking is being eliminated and people are interested in smoothies, getting into the green foods, CrossFit, cycling. Some of the challenges we still have are e-cigarettes, cellular phone use, and sitting too much. And there has been an increase in suicides. So we got to engage in collective courage, which is trying new activities with supportive friends. And then at the end, we evaluate for extras. We got to get all the foundation down first. And then if we do need supplements, we'll add those in. Okay. Remember that medications disrupt the body of certain nutrients we need. So sometimes we need supplements because we're on medications. If we get off the medications, we might not need those supplements. In my experience, most adults generally need magnesium because we're deficient. I told you about omega-3s. As long as people can tolerate omega-3s, most people need vitamin D3 and K2 together, or at least taken throughout the day together. CoQ10, most people need some CoQ10, some don't, but CoQ10 is a great energy provider. And most people need B complex because we're all busy and we spin through our Bs so fast. And then sometimes probiotics, but certainly probiotics if you're on antibiotics. And then don't forget to ask yourself, what is your why? This is the stimulant for you changing, whether or not you're committed. And if you believe that the changes that you're making are going to make a difference. This is what I call the 3 legs of the stool that allow you, to have a stable and long-term outcome. And with that, I'm going to wrap it up. And it's been a pleasure talking to you about all the ways that you can renew your warranty, particularly if you know what you desire, and then you can achieve it. So thank you.